my name is Lauren Horn, Clinical Consultant for Stanley Healthcare. Today we're going to be discussing the multiple functions of the reset button. Conveniently located on the front of the Stanley Healthcare M200 fall monitor. The first function I'm going to discuss is the delay settings. By pressing that reset button twice, I can toggle between 1 second delay.
Alarm delay is set to 2 seconds.
A 2-second delay.
Alarm delay is set to 0 seconds.
And 0 seconds. I'm going to leave it at 0 seconds because I'm going to sit down in the chair, and 0 seconds is the optimal setting when I'm monitoring a patient in the chair. You'll notice as I sit down, the reset button will flash green and give me a positive confirmation tone, allowing me to know that my patient is monitored. I always check to make sure the reset button is green before I leave them. If they exit the pad at any point, the reset button will flash red. I can press it once and clear the alarm. The next function that I'm going to be discussing is how to transfer patients, and there's 2 settings to put it in: hold or suspend. So I'm going to sit back down in the chair at this point. I notice that I'm now monitoring my patient, and if I want to transfer them from the chair to the bed, I can put this in a 30-second hold mode by holding down the reset button for 2 seconds.
Hold mode 30 seconds.
Now it's set at a hold mode for 30 seconds. I can now transfer my patient from the chair to the bed. You'll notice as I sit down on the bed pad, it is now identifying me as I sit down, and it is now monitoring. I can now leave my patient. The last function is to put it in a 2-minute suspend. To put the monitor in a 2-minute suspend, I will hold down that reset button for 4 seconds.
Suspend mode 2 minutes.
It now tells me that it's in suspend mode for 2 minutes. I can now move my patient off of the pad. They can even sit back down, and it will not go back into monitor mode until the 2 minutes is up, or I press and hold the reset button. Again, I notice that it's green. I can now leave my patient.